welcome to France in Focus. This week we're talking about one of the pillars of the French state, and it's not liberté, égalité or fraternité, but social security. This is essentially France's version of the welfare state, a massive safety net to catch anyone who falls ill, loses their job or decides to retire. Now this year it is the 75th birthday of this most French of institutions, so we're starting our programme by going back in time and looking at the history of la sécurité sociale.
The idea has been around for a while. In the Middle Ages, certain professionals wanted to cover themselves, so they set up limited protections for those who joined them. But it wouldn't be until the 19th century that private and non-compulsory insurance policies would be created. After its inception, the idea of a national solidarity fund gained momentum. Shortly before 1900, the state set up medical help for sick citizens, with the list of those covered slowly growing to include victims of work accidents, the elderly and more. After the First World War, health insurance and a pension scheme were put in place, but the benefits were low and it was difficult to access. At the end of the Second World War, Charles de Gaulle officially instituted Social Security by decree. The following year, it was accepted by the National Assembly and rolled out to all French citizens. But there was a problem. The 6 years of war had ruined the country and its economy, and over 2 million people were left homeless. Such sweeping social reforms proved difficult to implement, so measures were brought in slowly. Civil servants were covered in 1947, soldiers and their families in 1949, and farmers were given pensions in 1952. In 1966, 21 years after de Gaulle's decree, health coverage finally became a reality for all French citizens. Unlike in the UK, where the system is funded by all, France's system is funded only by the working population. But the French system does have its flaws. The ever-debated social security hole in the country's finances continues to grow. In 2018, the government spent 470 billion euros in social security. That's almost 25% of GDP. So far, every politician has failed to find the silver bullet to solve the ever-growing problem.
France's social security net doesn't come cheap. The government was hoping to be able to balance the books by 2024, but the pandemic had other ideas. As a result of COVID-19, France's health insurance scheme is in debt to the tune of 136 billion euros.
The return to a balanced budget was forecast for 2023, the year the deficit was to stop growing. But thanks to the coronavirus pandemic, Social Security has plunged into the red this year. A 44.4 billion euro deficit, a shortfall unheard of in 75 years.
We were very close to the goal, with a forecast of 5.4 billion euros. That's now exploded into 44 billion euros due to the current circumstances this year, but it will remain high for the long term. We have to find a way of straightening out the social security accounts, and this will require structural reforms that we must identify.
A record increase in healthcare spending, compounded by a historic drop in social contributions linked to the lockdown, are behind the eye-popping figure. Of the several different branches of Social Security, like retirement or workers' compensation, healthcare has the highest deficit, nearly 30 billion euros. The state has already spent nearly 15 billion euros fighting the pandemic, mostly on medical equipment and virus testing. But bigger debt means a longer repayment period. In the 2021 projected budget for Social Security, the government was careful not to give a date for when it will close the deficit. Except the Auditor General, France's watchdog for public expenditures, has warned the debt can't be carried forward indefinitely. Its president says it will be necessary to cut expenses.
If we don't do it, at some point the debt will take its revenge. And the debt will block the financing of public services. At that point, there will only be a choice between the American system, which is not the one we naturally prefer, or a choice to massively reduce coverage.
Before the pandemic, the government considered cost-cutting measures at public hospitals by reducing the number of operations deemed non-essential. a scenario upended by the current healthcare crisis. For 2021, the government has forecast the deficit will be around 27 billion euros. That's the same number as after the subprime crisis 10 years ago.
Well, we're joined now by Benjamin FERRAS. You are an expert in French social security, a professor at Sciences Po. Thank you very much for coming to talk to us today.
Merci à vous.
First of all, we know French people pride themselves on their social security system. It's seen as being accessible and affordable. But is the French system particularly unique?
75 years ago, those who pushed for the social security system said, we want social security. 75 years later, the talk is all about, we must protect the social security system. This gives us a good idea of how far we've come. The French are very attached to the system because it outlines a way for us to all live together. Compared to other systems, it's very ambitious. It covers people very well. Do French people appreciate its uniqueness? Maybe, but maybe not enough. Because France allocates a very important part of its earnings towards social protection compared to other developed countries.
I think many people in countries around the world will be surprised by how much is covered by French health insurance, by the social security system. Do you think actually the system could even be too generous?
Too generous? I don't know. The French took the decision to allocate a very important part of the country's earnings towards social protection. It's one of the highest rates in the world. But that's because we put it at the centre of our social contract. We want a high level of redistribution, and we provide help to people who need it most. That's what the people who created the Social Security programme in 1945 wanted, and it's what the system still does today.
Now, universal healthcare is a big part of the French social security system, and 20 years ago, the World Health Organization said this was the best in the world. But is that still the case today?
How does France's healthcare system compare with other countries? Like most industrialized countries, France has universal health coverage. It also has top-up insurance, or mutuelle, which reimburses costs not covered by the state. In 2019, France spent 11.2% of GDP on healthcare, the third highest in the world, along with Germany. High admin costs and other factors meant the US spent the most, despite 27 million people having no insurance whatsoever and quality being classed as low by OECD measures. France has an average of 6 hospital beds per 1,000 people. That's above the OECD average of 4.7, but far below the likes of Japan or Korea. When it comes to waiting times, France trails in 9th place, behind Germany, the Netherlands, the US, the UK, and Switzerland, who took the top spots. It's impossible to say one system is categorically better than another, but at just under 83, France does boast a good life expectancy figure, the third highest in Europe, behind Spain and Italy.
Now, we just heard in that report about some of the challenges that social security is facing today, and I imagine COVID-19 has just made all of that harder.
Maybe not worse, but it has revealed 3 things. The first is that it helps to maintain people's revenues throughout a crisis, especially people on lower incomes, and that is essential for our society. The second point is that our system provides everyone with access to healthcare. And when a treatment is developed for COVID-19, it will no doubt be available for everyone very quickly. Third, in terms of the economy, it brings stability. It maintains demand even throughout a crisis. So our economy might not suffer as much as other countries where there's less redistribution of wealth. However, in return, the system must be financed, and that creates debt, deficit. This will have to be paid for at some point.
Are there any areas of the French healthcare system or of social security in general that could do with improving? Where are the weaknesses here?
The role of the social security system is to respond to the needs of the population, and the population has changed a lot over the past 75 years. So this year we've made an addition to the system, and it's now going to cover people with disabilities and older people who require help from a carer. It's a very important step. I do feel that on top of the help we provide to people with fragile conditions or the older population, we must also make significant efforts for the younger generations, namely those between the age of 16 and 30 years old. They've been hit very hard by the current economic issues, and those of them who need help the most aren't necessarily receiving enough. But we want to make sure that we're helping both sides of the population. It's without doubt one of the biggest challenges that our system's facing. However, money doesn't grow on trees, and this means that we'll have to make choices. We might have to make changes to who gets what and find new modes of financing the system, but we must balance things fairly between both sides.
Benjamin FERRAS, thank you very much indeed for coming to talk to us today and sharing your thoughts with us.
Thank you very much.
So that's it for this week's episode. Thank you very much for watching, and we'll see you at the same time next week.